These are my disclosures. You missed my first slide. Can you go back 2 slides real quick, please? So this represents preliminary data from a prospective randomized trial of standard 4-port cholecystectomy versus single incision laparoscopic cholecystectomy. Next slide, please. These are my disclosures. I am a consultant for Covidien, and this study was completely supported in a worldwide multi-center trial by Covidien. Next slide. So the goals were to assess the feasibility and safety of performing Sills cholecystectomy and compare this to a standard 4-port laparoscopic cholecystectomy. The goals were to randomize in a 1.5 to 1 ratio with the goal of including 200 patients worldwide. Next slide, please. Patients were included if they had obviously minimal disease, including biliary dyskinesia or gallstone disease without acute cholecystitis and a BMI less than 45. Next slide. In terms of our results, and this is based on 85 patients so far with a median follow-up of 3.5 months. Basically, the Sills study showed a longer operative time for Sills patients. There were no difference, however, related to any adverse events, estimated blood loss, average pain, nor worse pain. In terms of looking at other parameters of measuring, photo series questionnaires did show, however, significantly higher scores for the Sills study, as well as a body image and cosmesis score improvement for those that underwent Sills versus standard laparoscopic cholecystectomy. Next slide, please. In addition, when we looked at patients asking them if they would rather have a Sills versus standard 4-port cholecystectomy following the surgery, almost 90% of Sills patients would prefer to have, again, a Sills cholecystectomy, and upwards of 60% of the standard 4-port cholecystectomy patients would also prefer to have a Sills cholecystectomy when asked after surgery, and only 13% of Sills patients or the open cholecystectomy would have preferred to have a 4-port cholecystectomy. Surprisingly, satisfaction scores were, however, similar for both groups. Next slide, please. So in conclusion, preliminary results of this study showed that basically Sills procedures are safe, at least in an early trial evaluation. Operative times are significantly longer for Sills, as would be expected for a new type of procedure like this. Cosmesis and body image scores are higher when compared to standard 4-port cholecystectomy, although satisfaction scores were similar. Thank you very much.